My name is Stephanie Bernard with Cary Orthopaedic Physical Therapy. I am a PTA and I'm going to discuss with you today one of my specialties called BPPV, or Benign Paroxysmal Positional Vertigo. BPPV is one of the most common causes of vertigo. It can be brought on by a multiple of different things, such as car accident, beauty parlor, or it's even sitting in the dentist chair. It usually comes on pretty suddenly, depending on your position and if you're moving, but it only lasts usually a minute or two. It can be as extreme as making you nauseous, but it can also be very mild, and people oftentimes drive with it and don't even know that something's wrong until they turn their head. BPPV happens when stones in your inner ear, called otoconia, are displaced and they end up in the semicircular canals. Those canals are what triggers, along with the hair cells inside of the canals, what your positioning is of your body. So when those stones get displaced and they end up rolling around in your semicircular canals, that is the feeling that you get of the dizziness. The goal of the physical therapist is to get those otoconia away from the semicircular canals and reabsorbed into the vestibular system where they should be. BPPV is diagnosed with a maneuver called the Dix Hallpike. Basically, your head is turned to a 45-degree angle and you're brought back into 20 degrees of extension, and then we look for something called nystagmus. Nystagmus is basically where the eye will move and flutter, if you will, and that tells us definitely that you have crystals in the semicircular canals where they do not belong. There's also a maneuver called a log roll, which is where we test out the horizontal canals, and that's usually the most severe, and that's usually when you feel like you're going to vomit. If the Dix Hallpike maneuver does not reproduce your symptoms or the nystagmus, then the vertigo is being triggered by your brain. There are two different ways that we can treat this. They are habituation and adaptation. Habituation is where we give you a series of exercises where you're moving your head back and forth and focusing on different letters or words to try to get your brain to understand that these are not movements that should cause you vertigo. Adaptation is more of an eye movement versus a head movement. Both of them are very challenging if you're experiencing motion sickness, and the goal is to get yourself almost to the point of dizziness, but not to the point of being sick. Doing these movements over and over again will help to basically retrain your brain to understand that these things should not be causing you sickness.